So today we're going to be working on maintaining a sterile field if we're working with our clients. So things we want to consider is that of course I would want to have all my items on a clean surface. Again, any supplies that I'm using, I want to check any orders before, and I want to make sure that everything is the correct kit and not expired, and that there's no integrity breaks in the packaging. Also, if I were to be working with my client and doing a sterile procedure, I would also want to make sure that my patient was up at above the level of my waist. Of course, I'd be doing any introductions, hand hygiene upon entering the room. This is just to show you the principles of sterility to kind of keep in mind. Okay, so I'll have them up on my waist. I would do hand hygiene. Again, one more time before working with this kit. So again, I've checked the label. I'm going to undo the seal here. Okay, and I can remove my sterile kit from inside. Again, it's on a clean surface. If I were to use this kit or this bag, I could even use this as a garbage, as we will use when we're doing Foley's in the future. So I could put this on my patient's bed as I work with it. I can discard of my label as well. And if you're not sure if you've touched anything and contaminated yourself, you can always do hand hygiene one more time before you are opening your kit here. So how these work, again, I am above the level of my waist. When opening the package, I am going to open away, the side, and then closest to me. So I'm going to reach around the package to open the flap furthest from me. I'm going to do this side, and note that I'm using my right hand to open up the right flap. I'm not crossing over in any way. And then I'm going to take this one to pinch. I need to keep this open. And I can only touch that 1-inch border, or the 2.5 centimeters. I'm going to grab this one and open it. And so again, I wouldn't want this to at all touch my clothes. I can now grab just the border, making sure that my kit doesn't become contaminated. If this flopped over like this, I could obviously change out my kit because if I broke sterility. So again, I can only work, again, with non-sterile hands. I can only touch the 1-inch border, or 2.5 centimeters. At this point, I would have to be conscious to not cross over my sterile field in any way. In most of your kits, again, you may find gloves immediately on the top. So all I could do right now, when I just have my non-sterile hands, that I've done my sanitizer, I can grab out that pair of gloves, come over on the side, apply those sterile gloves. With those sterile gloves now, I would be able to touch wherever I wanted within this kit, okay? So again, I have to make sure that I never turn my back on this, because if I turn my back, I now broke sterility. If I cross over my field to grab something, I've now also broken sterility. If I leave this open and unattended for too long, I've now allowed bacteria to be exposed to this kit, so it's also no longer sterile. If I have to have anyone hand me something that maybe wasn't in my kit or I didn't bring with me, they can come and they can drop it onto my sterile field, or they can open it up for me on the side so I can grab it. But again, if I was grabbing anything from them and I'm grabbing that sterile item, I'd have to already have my sterile gloves on. So again, with sterile gloves, I can touch wherever I wanted within this kit, but I cannot cross over, okay? So if I did need to grab something on that other side, I'd have to kind of come around and grab whatever items I needed, okay? So again, as I'm working with my client, you want to position yourself in a way so that way I can still watch my client and watch my kit, okay, without turning my back. If I am working with fluids at all, I do have to be conscious that, again, these can be possibly the first time it's being opened, or it could have already been opened. If it was, I would have to make sure that this was still within 24 hours. So if you are the one to open it and you plan to reuse, I'd have to have my initials, the date, and the timeline here. If I'm going to be touching this bottle, I could not have sterile gloves on, right? So this is a contaminated bottle. On the outside, the only part of it that's sterile is the fluid inside. So I can only touch with my dirty hands or clean hands, but not sterile. So for this again, this is contaminated, this is contaminated. So if I was working with this, sometimes you have kits that you can actually have opened your kit and where you need to pour it is already exposed to you. So you could work with 2 hands and pour. Other times you might have, you have to don one sterile glove and keep your other hand not gloved yet. So that way you can move items off to the side and then work with your non-dominant hand to pour whatever you needed. So if I were to open this again, I check that it's not expired. I would remove the lid. When I place the lid down, I cannot put it on my sterile field, otherwise I will contaminate it. I can place it face up like that though. I would make sure that, again, I lip off a little bit of fluid into the garbage can, so a plastic lined garbage can. I would say I'd have one over here that I would lip off. Again, I don't want to bring it all the way down here because then we're contaminating again. Keeping it up here, pouring it off into that plastic lined garbage. When I am pouring, you want to make sure that the label is facing the palm of your hand. Okay, so we would always lip, and then we pour our solution into our receptacle that we're using for our sterile procedure. Your book and ATI kind of refer to kind of keeping it about at least 2 inches. Sometimes again, if you work in OR or those sterile settings, they do talk more about at least about 6 inches above to kind of prevent that contamination. But again, I would not be reaching over. I would have to be pouring somewhere into a bin closer to me, or if it was further away, I'd have to come around to do that pour. Okay, and then I would be done. I would close that back off. Right, and again, always inform your patients too that you're going to be working with a sterile area to please not move around a whole lot and to try not to like touch the kits in those cases then. Okay, thank you.